This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
We have a follow-up comment/question from Kimberly. She says, I was on the Bondi protocol that didn't work. I really want to increase my chances as I only have 2 embryos in storage. Being in Brisbane, can you, Prof, see me as a patient? This has been my dream, so I'd love to increase my chances. My biggest concern is finances. And she then says, my embryo that was transferred was a 3BB. I'm not sure what that means.
Yeah, okay. Well, first of all, I am more than happy to do consults around Australia, or even, as I said at the beginning of the program, I've got talking to a lady in Florida in the United States tonight. So if you want to talk to me and have a consultation, I'm more than happy to do that. If you contact my secretary, and the number I think is on the screen or there.
I've just posted the number in the chat, Prof. It's 9138 4222. Is that right?
That's correct. And organise a Zoom consult. Obviously, there's a normal charge for a consult of, I can't remember what numbers are, but they're 300 and something. But that, you're getting half an hour at least of my time. When you make the consult, I'll probably ask you to send an email with as many of the results as you have, so I've got something to work from. And so more than happy to try and help. Yeah.
I'll ask the next question, Prof. What role does clinical intuition play alongside data and protocols, and can intuition be taught or only learned through experience?
What sort of answer do you expect for that question from someone that's been around doing IVF for 40 years? Of course I'm the best, because it is clinical intuition. It does play a part. Obviously, keeping up with the literature and keeping up with research and is a vital part of being able to give good opinions. And I'm afraid my experience of colleagues over many, many years is they will keep doing the same things again and again and again without actually thinking about what might be useful to be different, nor necessarily keeping up to date with newest things coming out. It does worry me that many patients are probably being shortchanged. The biggest joy in my life, in fact, I may say bad for the patients, but the biggest joy in my life hasn't been getting patients pregnant, because up to a point they should, and I'm just a technician in that game. The biggest joy in my life has been teaching other people, my juniors, hopefully some of that intuition that I think I have. I suppose the bottom line is when you're looking for a fertility specialist, the odd job gynecologist who does a lot of obstetrics and a little bit of IVF is probably not the best person to give you the best treatment for your particular case. Find a specialist with significant fertility experience, doing significant number of cycles involved, and in the clinic where they will be exposed to conversations about the latest things happening.
Prof, should emotional readiness ever influence treatment timing, and how do you approach patients with very different levels of resilience?
I think it's impossible. So the emotional state of a patient varies substantially. Because for some patients, they're keen to have a baby, but they're not desperate and can see their life without a baby as being an option. Through to the other end of the scale, where I used an example in an earlier question of the woman that tried 32 times with IVF and still ended up with no baby. But she kept on trying because she was resilient, but also driven. So driven to keep going and going and going, hoping that, even when I was saying there's less than a 1% chance, she still wanted to take that chance. So it's obviously when I do my consultations, I try and gauge what that degree of resilience, but also the degree of desire to have a baby, and that's not just the female; that includes the male as well. The male is not necessarily just sitting there hoping that she gets pregnant. He wants, often, very, very much wants the pregnancy, and in fact, I've had situations where it was the husband that was driving the desire rather than the woman. So, having time with your specialist to actually explore that option, the various options, and for him or her to actually assess that is very important, because it sets you up as a patient for the sort of care that you might get. I say to my nurses, Mrs. Smith, I had a chat with her yesterday. She's really wound up about this whole thing. Please, treat her with kid gloves. Make sure you can be reassuring along the way through the cycle. We do that with all patients, but sometimes I will pick up patients who need a bit more. And at Life Fertility in Sydney, we actually are priding ourselves on having that sort of support through the cycles.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.